How much water should I drink daily while taking GLP-1 medication? If you're taking a GLP-1 medication, staying hydrated isn't just important, it's essential for managing side effects and getting the most from your treatment. These medications work by slowing down how quickly your stomach empties and by reducing your appetite. That's great for blood sugar control and weight management, but it creates some unique hydration challenges you need to know about. First, the slower gastric emptying can cause gastrointestinal side effects. Research shows that nausea, vomiting, and diarrhea can affect a significant number of patients, especially when you're adjusting to a new dose. These symptoms can lead to fluid loss. Second, because these medications reduce your appetite, you might naturally drink less throughout the day without even realizing it. You're consuming less food and beverages overall, which means less fluid intake. Here's what makes this particularly important. The FDA labels for GLP-1 medications include warnings about acute kidney injury risk, especially when dehydration happens from severe gastrointestinal symptoms. So staying on top of your hydration isn't just about comfort, it's about safety. So how much water should you actually be drinking? The National Academy of Medicine recommends about 91 ounces daily for women and 125 ounces for men. That's roughly 2.7 to 3.7 liters, and that's from all beverages and food sources combined under normal conditions. But here's the thing, your individual needs might be different. Your body weight matters, your activity level matters, and if you're experiencing gastrointestinal symptoms, you'll need more. You should also increase your fluid intake during dose escalation periods when you're physically active, in hot weather, or anytime you're dealing with nausea, vomiting, or diarrhea. Now, if you have kidney disease, heart failure, or you're on fluid restrictions for any reason, these general targets don't apply to you. You'll need to follow your healthcare provider's specific guidance for your situation. Think of these numbers as a starting point to discuss with your healthcare provider. They can help you figure out what's right for your specific situation. Now, let's talk about recognizing dehydration. Your body gives you signals. Dark urine is one of the most obvious signs. If you're urinating less frequently than usual, that's another red flag. Fatigue, dizziness, and dry mouth are also common indicators that you're not getting enough fluids. Pay attention to these signs, especially when you're adjusting to a new dose or if your side effects are more intense than usual. Here are some practical strategies to help you stay hydrated. Keep water with you throughout the day. Seriously, having a water bottle within reach makes a huge difference. Sip consistently rather than trying to chug large amounts at once. Remember, your stomach is emptying more slowly on these medications, so small, frequent sips work better. If plain water doesn't appeal to you, that's okay. Herbal teas, flavored water, and broths all count toward your fluid intake. Foods with high water content, like fruits and vegetables, contribute too. Even your morning coffee or tea counts, though you'll want to avoid excessive amounts of caffeinated or sugary beverages. If you're dealing with nausea, cold or room temperature beverages might be easier to tolerate than hot ones. Let's talk about when you need to reach out to your doctor. If you're experiencing severe or persistent nausea, vomiting, or diarrhea, don't wait. Contact your healthcare provider. If you're having trouble keeping fluids down, that's another situation where you need medical guidance right away. Severe dehydration symptoms require immediate medical attention. We're talking about extreme dizziness, confusion, rapid heartbeat, or very dark urine with significantly decreased urination. Your healthcare provider has options if you're struggling with hydration despite your best efforts. They might adjust your medication dosing, they can prescribe anti-nausea medications, or they might recommend other treatment modifications to help you manage better. Here's what you need to remember. Aim for approximately 91 to 125 ounces of total daily fluid intake from all sources, adjusted for your individual needs. Watch for signs of dehydration like dark urine, decreased urination, fatigue, and dizziness, and increase your fluid intake during dose changes, physical activity, hot weather, or when you're experiencing gastrointestinal symptoms. Always talk to your healthcare provider about your specific hydration needs and any concerns you have. They can give you personalized advice based on your medical history and how you're responding to treatment. What strategies have helped you stay hydrated on GLP-1 medications? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.